Foothills Hospital, joined by Health Minister Jason Kenney and leaders of Alberta Health Services for a very important announcement about progress that we are making at expanding healthcare capacity in Alberta as we exit the worst of COVID. It's great to be here as we continue to support, transform, and strengthen Alberta's healthcare system so that it continues to provide top quality care and services to Albertans who need it, when and where they need it. As I said, I'm here with Minister Kenney, but as well Dr. Sid Viner, Vice President and Medical Director of Clinical Operations at Alberta Health Services. I'd like to take this opportunity first off to thank all of the physicians, nurses, and staff at the Foothills and in hospitals across the province who are saving lives right now and providing patients and the critical care they need and deserve. You are the bedrock of our health system and have dedicated your lives to protect the lives of Albertans. And that was especially true during the 2 tough years of COVID-19 in our province and around the world. Now, one thing that we learned in COVID is that the Canadian healthcare system does not have adequate capacity, period, full stop. And we learned in Alberta that that was especially true. When our government took office in the spring of 2019, Alberta had the second highest healthcare expenditures in Canada on a per capita basis. And for a long time, for many, many years, we had been the most or second most expensive health system in the country. And yet, at the same time, we had the lowest per capita number of ICU beds available in the country. So the second most expensive system with the lowest number of ICU beds. That did not serve us well through the COVID crisis because during various peaks, we were at risk of running out of ICU capacity. We had to pause and delay surgeries in order to create the surge capacity that we needed to provide critical care to COVID-19 patients at hospitals like this across the province. So there's something profoundly wrong with one of the most expensive systems in the world having such a low number of available ICU beds. The situation we inherited in 2019 and which we ended up taking into COVID a year later in the spring of 2020. Now that is why in this year's budget, Alberta's government announced an additional $300 million over 3 years to open and fully staff 50 new ICU beds in hospitals across the province. That's part of our $1.9 billion increase in the baseline budget for healthcare in Alberta. And that's on top of the billions of dollars of contingency funding that we gave to our hospitals and health system to cope with COVID. This commitment to meaningfully increase capacity is a big boost to Alberta's health system and part of our promise to add more permanent beds, more staff, and more resiliency so that surge capacity doesn't have to be added during high-demand times, such as pandemic waves or annual flu seasons, when more people typically head to hospital. I'm very pleased to announce today that we have already opened 19 of those 50 additional permanent ICU beds in the Alberta healthcare system, so we're already making meaningful progress. These beds are staffed with new registered nurses, healthcare aides, unit clerks, respiratory therapists, and other allied health professionals who will keep those beds open when needed. And when demand and pressure slows down, there's flexibility to redeploy staff to other areas where needs for care and treatment are higher. We're building a flexible, resilient health system that can expand and contract based on community needs and demand, a system that will be better prepared for any health emergencies that we might face in the future. This is only one of many actions that we're taking to strengthen the health system and to increase capacity. Right here at the Foothills, for example, we're also adding 11 additional operating rooms to the current 32 ORs. This will allow the fantastic nurses, physicians, surgeons, and care teams here at the Foothills who perform over 7,000 surgeries every year on top of the 20, they'll add that number to the 21,000 already delivered. And this is just one hospital. We're expanding operating rooms across Alberta to provide more surgeries and bring down wait times. We're providing thousands more publicly funded cataract surgeries in chartered surgical facilities and already have the shortest waits for cataract removal we've seen in years since 2014. We have an action plan to provide more CT scans and MRIs to Albertans so that they can have faster access to diagnostic imaging and options. We're significantly increasing funding for EMS to put more ambulances on the street and improve response times. We're opening more than 1,500 new continuing care spaces across Alberta this fiscal year. And this work to transform healthcare and expand our capacity is just part of Alberta's recovery plan to grow our province and create new opportunities. Part of this has to be expanding our healthcare workforce, which we are addressing through the Alberta at Work initiative, funded by $600 million in this year's balanced budget to help to fund targeted seats for in-demand occupations like nurses in our province. We've added 1,800 nurses to the Alberta health system over the past 3 years, but as we saw through COVID, with many retiring and aging out of the system, we need to bring even more in. And that's especially true in many of our rural hospitals and health centres, which from time to time struggle with physician and nurse retention and recruitment, which is why we provided an additional $90 million in funding for rural physician retention recruitment and $16 million in this year's budget, as well as through the collective bargaining agreement with the Nurses Association to help with rural nurse recruitment and retention. So I'd like to congratulate Alberta Health Services for moving forward quickly to add these new beds that were funded in this year's budget. It is good news. And it means that in the future, should we face particular stress points, but be it from COVID, the flu, natural disasters, that we will have that additional baseline critical care capacity, meaning that we will not have to resort to postponement of surgeries to deal with significant pressure on critical care in the province. And with that, I'm happy to invite Minister Copping to add a few words.
Thank you, Premier, and good morning, everyone. It's a pleasure to be here in this space that is currently under renovations, and it will be the site of a number of new beds and hospital rooms. Over the past few weeks, I've been visiting some of the province's hospitals, including the Royal Alex in Edmonton, the Red Deer Hospital, and the Foothills here in Calgary. The work that's happening on the front lines is truly impressive, and I want to thank all of the physicians, nurses, and support staff for their tremendous dedication and for providing world-class care to every Albertan who comes through the hospital doors. Our hospitals are under real strain right now. I see the numbers every day, and I hear it directly from the people and the front care, or the frontline healthcare workers that I meet. To put it simply, the hospitals are full up, and there are just a lot of new patients at the door every day in emergency. This hospital and others in Edmonton and in the surrounding Calgary area have been around 100% occupancy on and off in the recent weeks, and some have been over 100%. Like I've said before, including at my weekly COVID update earlier this week, the pandemic is obviously a big factor in the surge of patients that we are seeing right now. But the reality is our big metro hospitals have routinely run close to 100% in the core units and over 100% at peak times, even before the pandemic. The system needs more capacity, and it needed more capacity long before the pandemic. So we're adding that capacity right across the system, from EMS to surgery to continuing care, as the Premier noted. We need to get past the current wave of COVID-19 and get back to normal, but we also need to recognize that the normal we had before, quite frankly, wasn't good enough. We need to do better in terms of wait times and in terms of core capacity, so the system isn't strained so severely at peak times, even in a non-pandemic year. ICUs are a key part of that core capacity. They've been stretched too far in the pandemic, but they also see too much strain at peak times, even in what we would call a normal year. That's why Budget 2022 provided $100 million a year to staff 50 new permanent ICU beds across the province. And as the Premier has said, AHS has already opened and staffed 19 of these beds here in Calgary, in Edmonton, St. Albert, Grand Prairie, and Lethbridge. That includes 9 new ICU beds in Calgary, 2 here at the Rocky View, 2 at the South Health Campus, and 5 at the Foothills Hospital. This hospital now has 12 ICU beds. That will help manage the pressure on all hospitals right now and whenever the system is strained. AHS has plans to open the remaining 31 of the 50 new beds by September, and I look forward to giving more details as we move forward. But let's be clear, right now, today, this is a huge step forward. These first 19 beds are already the biggest increase since AHS was created, and the full 50 beds will be the biggest increase in decades. It's also National Nursing Week, so just a reminder that when we say we're adding hospital beds, what that means is adding the skilled people to staff them, and most of these skilled people are nurses. That applies most of all to ICU beds. Every one of these new beds means 10 to 15 new positions, 250 staff for all of these 19 beds. The health workforce is under pressure in Alberta and across Canada. It's been a very tough 2 years for our nurses and all of our healthcare staff. So the fact that AHS has been able to staff these beds speaks volumes about the commitment of nurses and other healthcare professionals. And it will help ease the strain on the overall workforce because more permanent ICU beds means less need to staff surge capacity when we need it. Nurses are the backbone of our healthcare system, and we owe them a huge debt of gratitude. I am encouraged to see that AHS has hired 90% of the nursing grads in the province in the past year. It's a great career, and I hope young people will continue to choose it. We promised Albertans a stronger publicly funded health system with better access to care. It's been a tough 2 years, but we stand by that promise, and we are going to deliver on it, and we are delivering on it. We're funding more surgeries in hospitals and clinics. We're funding more ambulances and more paramedics to staff them, more home care and more continuing care spaces, and more ICU beds. We're keeping our promise, and there's much more to come. So thank you, and I now like to call upon Greg Turnbull, the Chair of the Alberta Health Services Board.
Good morning, and thank you, Minister Copping. On behalf of the AHS Board and the staff and physicians of Alberta Health Services, it is an honour to join everyone today for this announcement. It is wonderful to be here to recognise the progress that has been achieved to open 19 of the planned 50 new ICU beds across the province. This accomplishment speaks to the dedicated work, collaboration, and partnerships of many teams, clinicians, physicians, leaders, and government. It also reflects our ability to learn and adapt to challenges and to shift from acute pandemic response now to recovery. We know the pandemic has impacted surgical activity across Canada. We are grateful to the patients of all Albertans who had their surgeries delayed as we took necessary steps to ensure our healthcare system was prepared to respond to COVID-19. We are working diligently to recover to pre-pandemic surgical activity as soon as possible and to accelerate the implementation of the Alberta Surgical Initiative, a 5-step plan to improve surgery in Alberta. We have already taken significant steps forward in the work of the Alberta Surgical Initiative, with new contracts signed with partnering chartered surgical facilities and more on the way. In closing, we are extremely proud of our AHS teams for rising to the unprecedented challenges the pandemic presented. We appreciate those who continue to provide care in the intensive care units across the province and all other healthcare workers across our organization. Your unwavering dedication is greatly appreciated, and your ability to rise to these challenges speaks to your commitment to providing the best care possible to Albertans when they need it most. On behalf of AHS and the AHS Board, I offer our gratitude to the Government of Alberta for this important investment in ICU care, and to our AHS staff, leadership and physicians for their ongoing work to support and improve patient care. I would now like to welcome Dr. Sid Viner to make a few words.
Good morning, everyone. I'm Dr. Sid Viner, Vice President and Medical Director, Clinical Operations at Alberta Health Services. It is my pleasure to be here today to celebrate this exciting announcement for Alberta's intensive care units. The highly skilled physicians and staff in Alberta's ICUs have faced tremendous pressure over the past 2 years. But like all facets of our healthcare system, they have risen to the challenge through dedication and innovation. On behalf of the executive leadership team at AHS, I would like to extend our gratitude to the Government of Alberta for this very important investment. I would now like to welcome Dr. Dan Zuege, Zone Clinical Department Head, Critical Care Medicine, to make some further comments. Thanks.
Good morning. Thank you, Dr. Viner. On behalf of all of the staff and physicians of our critical care department here in Calgary, and indeed our critical care colleagues across the province, it's an honor to join everyone for this very important announcement. As all of the previous speakers have outlined, our pandemic has placed tremendous strain on our healthcare system. Certainly our entire healthcare system, but in particular our ICU and critical care resources. Despite these pressures, our teams from across the province rose to meet those needs and did everything they could to ensure those who needed care were able to receive it. During the height of our pandemic, our ICU spaces in Alberta needed to increase from a baseline of 173 beds to 376 beds, over 200% to meet that demand. This indeed was a Herculean effort, but via these efforts, we were able to provide the critical care support for all who needed it during the pandemic. Currently, we're operating 212 general ICU beds across the province, and that includes the 19 permanently funded beds announced today, plus an additional 20 surge beds. Today, there are 162 people in those 212 beds, so most of them are occupied. So indeed, the addition of 50 new spaces to our baseline capacity is wonderful news. This will provide our ICUs important added capacity and reserve to meet the needs of Albertans with critical illness within the ebbs and flows of ICU demand that happen over time with or without a pandemic. We're extremely appreciative of all the work of the many teams across the AHS family who've worked tirelessly to make the opening of these initial 19 out of 50 beds happen in a timely fashion. Most importantly, to all the AHS staff, physicians, and volunteers, thank you for all you do to support our patients and each other throughout this journey. Again, on behalf of the department here in Calgary and across our critical care community in Alberta, thank you again for this very important investment. It will make a difference in our ability to provide the highest level of care when Albertans need it the most. Thank you very much.
Thank you, everyone. That concludes our formal speaking portion today. We're going to move to the media Q&A. We're going to start with media here in the room. There's a microphone right there for you to ask your questions. When you ask your question, please identify your outlet, who you're directing your question to, and we'll go with one question and one follow-up. Go ahead.
Hi, I'm Colleen Underwood, CBC News, Calgary. I just had a question. You mentioned the surgery and you're almost back to capacity. Can you just provide an update on where we are with surgery waits and when we expect to actually be caught up? Not sure who could answer that.
So I can start the answer to that question, then maybe ask Dr. Viner to provide further commentary. Right now we're sitting at about the latest numbers are roughly 92% of normal capacity. We are seeing the backlog continuing to drop over time. Now part of that is associated with, we've made tremendous progress, and I think we made an announcement a couple of weeks ago, on cataract surgery. So tremendous progress over the last year, and that is continuing. And that was our at one point in time our single biggest group of surgeries for backlogs. It is now not the largest. Orthopedics not the largest. So we are focused on that. The expectation is that and our focus is this year to get caught up on the COVID backlog within the next year plus. Make a meaningful impact on key areas where they have some of the largest backlogs, like cataract surgeries, ophthalmology, and as well as orthopedics. So driving very hard on that. There is some risk because even though we're seeing the numbers coming down, we may see another bump up, because part of that is that there's an overhead due to increased acuity, so people who weren't seeing their primary care family physicians, and so there is a backlog. So we may see a little bump up, but we'll have to wait and see how we go through that. But again, the answer to your question is we're going to get through the backlog this year. We're going to make a meaningful impact on which we're already seeing on some key areas like ophthalmology and orthopedics, and then continue to go from there. And that's part of the Alberta Surgical Initiative. But Dr. Viner, if you want to speak a little more on that, that would be great.
As Minister Copping said, currently I think we're doing quite well, all things considered. We're hitting about 90% or better of our pre-pandemic surgical volumes. Based on our current planning over the next year, we'll be where we were or better compared to pre-pandemic in terms of the wait list, and this is ensuring that we're prioritizing patients based on acuity and their wait times. And then within 2 years after that, we'll achieve the targets of the Alberta Surgical Initiative, which is to have less than 10% of people having their surgery outside of their target, kind of the clinically appropriate waiting time. So we've got an aggressive plan. We're moving forward in accordance with the plan, and those are the timelines.
Do you have a follow-up, colleague?
I do. It's for the Premier, but it's about his upcoming trip, so I can do it now or after people want to do health.
Go ahead.
Do you want me to do it now?
Yeah.
Okay,
Go
sure.
ahead.
Just asking you, as you head to the States, what exactly are you hoping to accomplish?
Right. Well, thank you. On the weekend, I'll be traveling to Washington, D.C. to address the U.S. Senate Energy Committee. This is part of the invitation from Senator Manchin during his recent 2.5-day visit to Alberta. It's an opportunity to highlight how much the United States depends on Alberta energy. We are the source of 60% of U.S. oil imports, and very few people on Capitol Hill know that. There is infinitely more focus on OPEC than on Alberta, but Alberta is infinitely more important to U.S. energy security and the American economy. The biggest issue in American politics in recent months has been inflation, the cost of living, the cost of energy in particular. And from the president to both aisles in Congress, American political leadership is laser focused on how to reduce the cost of energy and the cost of living. So much, and in the context of Putin's invasion of Ukraine, this has meant that President Biden pleading with Saudi Arabia to produce and ship more, lifting sanctions on Venezuelan oil exports and negotiating an end to the embargo on Iranian oil exports. The message I'll carry to Washington is this does not make sense for the United States or for world security to increase dependence on the world's worst regimes, that we need to be partners in a North American energy security strategy that gets more reliably produced energy from America's closest friend and ally to the United States to help address the current and future supply shortages. I'll also be sharing the huge progress that we've made on environmental performance, the big reduction in emissions intensity from the oil sands, and our future plans for net zero by 2050 in oil sands production. Again, I think many people in Congress are not aware of the big progress we've made and are planning to make in terms of environmental performance. So those would be the key points, just to raise awareness about the importance of Alberta to the American economy, to discuss strategies for increasing Alberta energy exports to the U.S., and thirdly, to make sure they understand our deep commitment to better environmental performance.
Thank you. Go ahead, Tim.
I should say, in addition to the actual hearing, I'll be meeting with several senior congressmen and senators at the margins of that. So I'll be there for about 2.5 days doing that.
Hey, Tim Brooke with CTV. If you want to take this one, or if Minister Copping wants to. Obviously, beds are just one thing here. I want to know what the plan is for staffing.
Yeah.
Who specifically are these people who are going to be hired? You mentioned people that can move between ICU, be redeployed if they're not needed there. So who are these people?
Sure. Well, I will refer to Jason for details, but you're absolutely, look, when we say we're creating beds, we don't mean literally just the physical space, because a bed in an empty room without staff is meaningless. So the big challenge here is staff, and that's what we faced during COVID. One of the reasons we went into COVID with the lowest per capita number of ICU beds, in Canada, was that we had about 830 trained and experienced intensive care nurses. And that workforce became the key limitation on our ability to deliver baseline critical care beds. We made every effort to increase that workforce through the pandemic. We accelerated training for regular RNs to get the certification to work in critical care. We accelerated certification of nurses graduating from our nurses' colleges. We tried to also recruit people who had retired back in. But for every additional person we brought in through the front door, there was somebody retiring. You know, we're facing this demographic challenge across every sector. And there are a lot of nurses who are in the baby boom generation who have done their great service for 30 years or more, and who became exhausted during COVID. And so for everyone we brought in the front, there was somebody leaving the system. And so we stayed relatively stable at about 830 trained and experienced ICU nurses through the 2 years of COVID. But that meant no gain in baseline beds. So what we're doing now is a big surge in terms of that training and recruitment. Hopefully, as the system stabilizes, as we emerge from the worst of COVID, we'll see fewer departures, and I'll invite Jason to talk about further progress being made on the work front side.
Thanks, Premier, and thanks for the question. So, you know, the staff and I'll get Dr. Viner to add more color if you know, in more detail if I don't cover it all. You know, the staff that they're hiring for the ICUs is, as the Premier said, is going to be permanent staff, because we know it's more than just about beds. There's 250 hired right now. You know, that's getting pulled in. The vast majority of it actually is being pulled in from already within the hospital system, so people are already working and they're applying, they're moving into it. But you know, especially when you take a look at nurses, you know, it's highly specialized from you know, the training required for an ICU nurse. But it's testament to, as I indicated in my remarks, the thanks to the people willing to step up, because this is a challenging job in the ICU. So the follow-up question is, okay, so you're pulling within the system, what's the impact on the other system? So we are continuing to hire. I've made references before to, 1,800 additional nurses, February 2020 versus May 2022, that have been hired into the system. AHS, we've also budgeted for further 2,800 positions overall, year over year from last year to this year. So hiring is happening. And I can tell you that a number of strategies are being used to be able to bring on more. Like roughly 90% of all grads, just over 90% of all grads in 21 or the last year for nursing have been hired here into AHS. They're also doing programs and working with students and bringing them in and having them work within the system. And my understanding was almost all 600 students that we had in the sort of the major programs were actually brought in to help during COVID. And one of the advantages of this is that not only do you get real life training on that, but then when it comes time to make a job offer and someone's already here, the likelihood to be able to hold on to it. So we fully appreciate that we are going to need to attract and retain more. Very pleased that an agreement was reached with UNA, and that also includes funding to be able to support nurses going to rural areas where there's a greater challenge to be able to attract and retain there. So this is our focus, in terms of staffing, because we understand that it's people who deliver the service to Albertans, and we need those people to be able to deliver those services. And with that, Dr. Viner, if you want to provide one of the comments. Just as he's coming up, and I just wanted to, for a previous question, just for numbers, in terms of the wait list. So we're under 73,000 now as of the end of April. This compares to 76,600 at the start of March, and the peak was 81,600 at the end of Delta. So the number is continuing to come down. We're still not where we need to be, which is 68,000, which was pre-COVID, and then we're going to drive it further down than that. So just for the details on that, Dr. Viner.
I think what I would add is it's important to recognize that the staff we need for these critical care beds are doctors, nurses, but also many other health disciplines, respiratory therapists, pharmacists. We need healthcare aides, unit clerks, and we're fortunate that our educational institutions in Alberta actually do graduate large numbers of health professionals. We've got other programs. We're creating a program internal to Alberta Health Services to train healthcare aides, for example, who are in relatively short supply or very much needed provincially. And, as was mentioned, effort going into looking at internationally trained healthcare staff who are in Alberta that may need a bit of additional training or just credentialing. They may have credentials to work within the system right now, and then international recruitment to the extent that that'll be helpful.
You have a follow-up?
Thanks. Yeah, follow-up is for the Premier. Different subject completely. Obviously, gas prices are back way up. We know you paused the provincial gas tax. Any other help coming, any other relief for Albertans as you look at the prices and at just inflation?
Well, we know people are really getting hammered by inflation. It's at a 35-year high. It's fuel, it's food, it's pretty much everything. And this is, Alberta's government has done more than any government in Canada by a country mile to help people with the cost of living. Pausing the fuel tax is about a $1.3 billion annual savings. When you roll in what we're going to do with the electricity rebate and the natural gas price cap, we're looking at about $2 billion of relief for consumers, which I say is way more than any province or the feds are providing. It doesn't look. The reality is that the commodity price is going back up, right? So oil is back up to like $107 today, and the prices go up with that. But we are still seeing, there was a lot of skepticism. A lot of people thought the retailers weren't going to pass on the 13-cent a litre savings. I want to thank the retailers. They took a lot of criticism before. but they have passed on the 13-cent savings, and we have by far the lowest gas prices in Canada, where I think last I saw we were about 65 cents lower than our neighbours in British Columbia. So it's less of a problem here, but it's still a problem. So if our fiscal and economic situation continues to improve as a province, we are considering stepping up with additional measures early this summer to help people with the cost of living. Late spring, early summer would be our horizon. We need to make sure that we are on a sustainable track. We're not going to go back into a multi-billion-dollar deficit overnight. But if we see continued progress on the fiscal and economic front, we may be in a position to provide other meaningful support to Albertans in the weeks to come. But you know, at the end of the day, there's some factors beyond our provincial control. The federal government has run a very they've run a very loose monetary policy, basically printing money, that has driven inflation. They've also had I would say, reckless fiscal policy that has also driven up inflation. So we need to see a federal commitment to getting inflation under control, and we need to see the world invest more in energy production. So we have the supply to meet future demand, and we're not dealing with $1.60 per litre gas.
Thank you. We'll take two more on the floor, and then we'll go to the phones. Go ahead.
Hi, Dylan Shore with Post Media. I'm not sure who this question is for exactly, maybe a little bit of everybody, but 50 beds, I'm sure it's welcomed by most people in the province, but is this enough? Where does this put us? As you said, we were below the lowest, I believe you said, in ICU per capita. Is this enough, especially given the cost of the beds?
Well, I'll take a stab at that and invite Dr. Viner to offer his clinical view. This is very substantial. I know 50 actually doesn't sound like a lot, 50 in a province of 4.5 million people, but it's a lot compared to the 173. That's been our baseline since AHS started 12 years ago. So this is, as Minister Copping said, the largest increase, actually the only increase in the number of baseline ICU beds since AHS came into being, and the largest increase that we can see in Alberta health history. So this is a big deal. Because just think about the staffing ratios here. You need about 5 staff. It depends on the situation, but 3.5 to 5 staff for every ICU bed. And you know, we've had 830 ICU nurses to staff, for example, because they're not all present on the same shift at the same time. We needed 830 ICU nurses to staff 173 baseline beds. So what would this overall, increasing by 50, the complement of baseline permanent ICU beds represents hundreds of additional healthcare workers. And these are many of the highest paid people with their specialties. So this is a significant investment. I think it will take us to above average in terms of the number, the per capita number of permanent ICU beds once this is done by September. Dr. Viner, tell us why you recommended the number 50.
So what we did actually in landing on the number of 50 as we looked at both through pandemic and historically the occupancy in the different ICUs across the province. We looked at the need to transfer patients. We do work as a provincial healthcare system, so both at a zone level and provincially during pandemic in order to optimize the use of all of our ICU beds, all of our critical care resources. We would either transfer patients or direct patients who might be coming in through, you know, STARS or, you know, into a major regional or urban center to a site that, you know, had the most beds. So based on historical occupancies, transfers in and out, projected future demand, yeah, we're pretty comfortable that the 50 beds will meet the need. Would also note that in addition to the what we call general systems ICU beds, we have additional critical care beds for specialized patient populations. So patients, for example, who undergo cardiac surgery, pretty well routinely will require an ICU bed. So these bed numbers are in addition to other critical care beds that exist in the province for other types of specialized care.
You have a follow-up, Dylan?
Yeah, this one's for the Premier as well. And again, apologies, but it's off topic. Recently, there's been 2 validators used in press releases to I guess, approve of policy changes. They've then gone on to sort of criticize the amount of information that they were given or say that more information was needed on changes. You look a little confused. So Diabetes Canada was one of them, and then the Pregnancy and Infant Loss Center was another one where they sort of came out and said that more information was needed. Given these about faces, does the government need to assess how much information they're giving to different stakeholders when they're announcing these different policy changes?
Yeah, perhaps. I'm not familiar with the 2 instances you raised. The challenge is typically when a ministry is preparing a news release for an announcement, they can't violate confidentiality and share what might still be a cabinet confidence in detail externally, but they do want to share some general information. So I think it's a bit of a tricky situation, but yeah, I would say at the end of the day, that Pregnancy and Infant Loss Center, they attended the news conference where the director in Edmonton was very happy about the bill we've brought forward to provide for job-protected paid leave for parents experiencing a pregnancy loss. And I think there was some ambiguity about how broad that would be, but we've taken on board their advice. And so that shows, I think, a respectful relationship with stakeholders. Similarly, Minister Copping has taken on the advice from Diabetes Canada to listen and consult more before proceeding with any further changes to coverage of insulin pumps. We've been trying to expand coverage, particularly to low-income people and kids in low-income families, also to help with the new higher tech medical equipment to help people living with diabetes. But there were some changes that were not adequately subject to consultation. And so when Diabetes Canada brought that to our attention this week, the minister hit the pause button. So there's always, in a big $65 billion government, there's always going to be some things that require, you got to modify your course. And we're not prideful about that. We're willing to listen and to change course when we believe it's a good thing to do that.
One more on the floor, then we'll go to the phones. Go ahead.
Sure. Hi, Jason Markisoff from, I guess, CBC News now. Yeah. Hi.
Okay. Is McLean still a thing?
We can. That's probably for offline.
Okay,
I would
sorry.
suppose.
I was wondering when I saw you. I didn't know. So
We can talk. You were quite happy with the ruling from the Alberta Court of Appeal this week. Of course, that is a ruling pending appeal from the Supreme Court. Thinking more broadly of your fair fight for fairness, fair it's called.
Fair deal. Fair
you
deal.
think of, there is still the federal consumer carbon tax. Equalization is what it was in 2019. You have a parole board hearing a few people a month. You have a firearms officer. To what extent has bringing Ottawa to heel, or the challenge of bringing Ottawa to heel, met your expectations?
Well, there is no doubt that we are dealing with probably the most hostile government that Alberta's had in Ottawa in our modern history, with the possible exception of the Pierre Trudeau government in the early 80s with the national energy policy. So I've never expected that Alberta's list of demands for fairness in the Federation would all be met under the Trudeau government, but that's not a reason to surrender, it's a reason to fight harder. And we've tried to do this by being smart and approaching it like we have 2 buckets of issues. There are those where we think we can find some common ground with the feds, and there are others where it's just full-on, frankly, confrontation. And what you haven't included in your list are a lot of things that are not front-page stories, but are very important. I'll share some. We managed to win an equivalency agreement from the feds to allow us to regulate major industrial emissions through our own program. And the industry says that has saved our heavy industry billions of dollars because Alberta takes a much more nuanced and experienced approach to regulating oil and gas than Ottawa ever could. We also won a huge fight to get control over methane regulations. And again, the industry has said that's probably saved upwards of $1 billion. A big deal. And we are achieving their goal for methane emission reduction at 1/3 the cost to industry. Big deal. Northern woodland caribou habitat. The feds were looking at a plan that could have sterilized up to 1/3 of the economically useful land in northern Alberta and cost as much as 6% of GDP. But we got an agreement with them to let us manage that much more effectively. And again, CAP and the forestry industry will tell you that was a big, big ticket item. We got some real satisfaction from the feds on the fiscal stabilization program. So we got a lifting of the cap on the program going forward, which brought about $400 million tax dollars back to Alberta. Doesn't go as far as we want, but it was, I would say, a partial success. And a number of other things. And of course, we're still looking at the big ticket items like potential Alberta Provincial Police and Provincial Pension Plan. And there is no doubt that on these items, we don't need Ottawa's consent. We have the clear legal authority to establish our own provincial police service. We obviously would have to, if we make that decision, we'd have to annul, pull out of the contract that ends at 2032. But there is clear legislation for us from 1964 to establish our own provincial pension plan. So I would say that we have had meaningful successes, but we've also had huge frustrations. But for me, really one of the central fights is over C-69, because that's almost existential for our economy. And by the way, I'll just close with this. The single most important file we have with the feds right now is TMX. And while I disagree with Justin Trudeau on a whole lot of things, I have to acknowledge that his government has remained committed to that project. We hope to see it completed in 2023.
Thank you very much. My follow-up question is for Mr. Copping or Mr. Turnbull, whoever wants to take this. What is the status of the search for the AHS CEO, and what sort of direction, what's your expectation will there be on the next CEO of being quite embracing of this government's reform agenda for the healthcare system?
So thanks for the question. I'll start, and then if Mr. Turnbull has anything to add, he can do so. So this is the job of the board to be able to choose, who the next CEO is, and my understanding that the choice of a search firm is it is going to be completed in a very short order to be able to continue on in terms of to go through that process. From the standpoint of the change, the transformation, I've had conversations with the board, but again, it's their call. But it's really about making the change because we need to transform our system. I once again thank Dr. Yu for her years of service, and she brought stability over a number of years, like a 6-year period. And you may recall that prior to that, we went through a number of CEOs at that period of time. So she brought stability. What we need is transformation, and we need to drive that transformation quickly. Part of that is about the Alberta Surgical Initiative. Part of that is also looking at, how do we as a system be able to ensure that we can attract and retain, a number of issues that have been raised about, AHS. And I just want to start saying I thank all the employees. They do a tremendous job, and they work incredibly hard. So it's not necessarily about the employees as the system. They're doing the great job they can, the best they can. But it's how do we actually build a system that is, innovative, can move through the transformation as we look to be able to get caught up on surgeries, to be flexible. And so these are the kind of conversations I'm having with the board. But again, the board, when it looks at, they have a mandate from the government. They understand that they need to have put in strategic plans to be able to deliver on that mandate, and they need someone who's going to lead AHS to also deliver on that mandate as well. But Mr. Turnbull, if you want to say a comment or two.
Just to add to Minister Copping, first, the duty of the AHS board is to find the next CEO, and that's our most important role. So I can tell you we're spending a lot of time and giving a lot of thought to this. We're embarking on a local, national, and international search. So we'll see exactly, what that delivers for us. I think fundamentally, though, we think Albertans should have the best health care in Canada and ideally in the world. So we're really looking at someone who's a visionary leader, who understands what we need as a province, and taking advantage of our provincially wide healthcare system to leverage that to every Albertan's benefit in this province. We're looking for a unicorn in some ways, and so it's a difficult process. We're just retaining our search firm. We're just now going to our stakeholders to seek their involvement and their suggestions and their ideas of what the ideal CEO will be. And stay tuned, because it's a developing process. So I think we will be back at the right time with an announcement when we have completed our search. So thank you.
Thank you. With that, we'll go to the phones. Operator, can you please put through our first caller?
Our first caller is David Staples, Edmonton Journal. Please go ahead.
Thanks for taking my call. My question is for the Premier. Premier, you set up the baseline in 2019 that we had the second highest provincial per capita cost for healthcare and the lowest service in ICU. With these changes and with all this new spending, where do we rank now in per capita spending, and where does our ICU capacity rank?
Well, we would still be at the bottom end of ICU capacity with these additional beds that we've opened so far. Once we get the full 50 open by September, we will, I understand, be pretty much at par with the national average, and certainly with our neighbours in British Columbia. We tend to keep a close eye on them as a comparative province. So we'll at least be where British Columbia has been in terms of baseline ICU bed capacity. In terms of overall spending, we have come down a few notches. We were, for the longest time, either the top or the second most expensive system in the country. Our rival was typically Newfoundland. They have a very expensive system because of all the rural outport hospitals they have to staff. But we have, brought in some restraint, particularly on the labor cost side. We've found other savings by contracting out ancillary services like food and laundry, now lab services. And those and other elements. So we did this performance review of Alberta Health Services that was conducted on our behalf by Ernst & Young, and we've implemented many of those recommendations. So those savings together, while other provinces have gone through much steeper labor cost increases in the past 3 years, means that we're now more towards the middle of the pack in terms of per capita expenditures right now.
Go ahead with your follow-up, David.
So there's systemic issues with our healthcare system in terms of both performance, as we saw during the pandemic, and with cost. And I think these are kind of internationally recognized that there's issues with the Canadian system costing a lot and not providing top-notch service. In terms of models and looking at ways that we can go based on the experience of other countries, there's always criticism if you try anything that hints of an American style. But are there other countries that are getting it better that you're looking at seriously modeling on?
Well, broadly, I think there's a well-founded consensus that the Canadian system is not getting the bang for the buck that Canadians deserve. Typically Canada is in the top quartile of the OECD in per capita health expenditures. But according to many metrics like surgical wait times, diagnostic wait times, healthcare personnel, and bed availability, we're in the bottom quartile of the developed world. And we saw this highlighted starkly through COVID, where many U.S. states had 2 to 3 times more ICU beds available because they have that much more staff. Now, that is not to say we should emulate the American system. It is in many ways deeply flawed, primarily because they don't have universal insurance. But the fact of the matter is that the redundancy created by competing health management organizations and hospital networks means overall they have more capacity. They also spend a heck of a lot more. They spend upwards of 19% of GDP on health. Canada is about 13%. So I don't think the American system is a model for us, but I think there are a range of other systems, including in Western Europe and in social democracies in Scandinavia, that have been much more flexible in how they deliver care within the context of universal public insurance. And I think I wish that the Canadian healthcare debate would be more open to looking at Holland, Sweden, Denmark, France and Germany, other countries that have universal insurance. It's not the American boogeyman. It's about leveraging the efficiency of the private sector when and where it makes sense to deliver more results. And that's partly what we are attempting to do through the Alberta Surgical Initiative, through a massive expansion of the number of surgical procedures that we will perform in chartered facilities that are, frankly, independently owned and operated. But all of them will be publicly insured. Now, you hear the NDP hollering that this represents, quotes, U.S. two-tier healthcare. They must know that that claim is just rubbish. It's completely disingenuous. They know that the legislation is very clear that these are publicly insured services. And they also know that they, as government, funded thousands of surgeries performed at chartered facilities. They also know that a huge portion of publicly insured Canadian health services are delivered by businesses, by, dare I say it, corporations. Almost every doctor in our system has a legal structure as a corporation. When you walk in to see your family physician, she or he is running a small business, and they are registered typically as a corporation. We contract to them as a business vendor. That's not a dirty word. So we believe that we know, based on the experience of Saskatchewan and other jurisdictions, and indeed here in Alberta, that we can get more surgeries done more quickly through competitive contracting to chartered facilities than having a government monopoly over all of the surgeries in our state hospitals. So this is an important step forward that moves past some of the blinkered ideology that for too long has limited meaningful health reform in Canada.
Thank you. Operator, could you please put through our next caller?
The next question is from Tom Vernon, Global News. Please go ahead.
Hi, Premier. Thanks for taking my question. I want to ask you about the Washington trip. Federal Minister Wilkinson's also going to be a witness on this panel. You two don't see eye to eye on a lot of energy policy. Are your offices working together to try to present a united front when you appear before this committee?
Well, I don't think we've coordinated messaging, but obviously there's some logistical coordination. I very much hope that Minister Wilkinson understands that Americans want and need more Canadian energy, and we don't need to be apologetic about that. We don't need to be the caricature of the apologetic Canadian. We should be loud and proud about the fact that we are the source of 60% of U.S. oil imports, and we have the third largest oil reserves on Earth. The Americans desperately need more energy, and the answer is Canada. I hope that's the message from Ottawa. It sure as heck will be from Alberta. And we are the owners of the resource. So I'll be making that clear, that we own the resource, we develop it, we regulate it, and 77% of Americans said they wanted Keystone XL. That's as close as you get to unanimity in a big democracy like the USA. So I think we'll be speaking. I know there will be, I'm sure, a couple of senators who are not friendly to the traditional energy industry, but they know that their constituents need to affordable energy, even while in the era of an energy transition. So our message will be very clear. I was at an event in CERA Week in Houston with Minister Wilkinson a couple of months ago, and there was only really one topic that people were focused on, which was how to replace the 7 million barrels a day exported by Putin's Russia. And people were focused on what Canada could do. But I was at an event where Minister Wilkinson stood up and basically didn't even mention Canadian energy, oil production or exports. And it was like he was addressing a pre-Ukraine invasion crowd. So I hope the federal government has been mugged by reality along with the rest of the world following the invasion of Ukraine and speaks to the new geopolitical reality around energy.
Go ahead with your follow-up, Tom.
A completely different topic. I'm sure you've heard all the talk. There's a number of people floating the idea out there that there could be a snap election this September to the results of the leadership review. Do you commit to holding an election if you survive the leadership review on schedule next spring?
Yes.
Or is an early election an option?
No, I commit to the legislated election date in late May of 2023, unequivocally, period, full stop. That kind of speculation is, I don't know. I think that sometimes political hacks entertain themselves by inventing rumors like that. I have never heard anybody in my in the UCP discuss that as even an option. We passed just this year legislation to establish not just we used to have an Alberta fixed election period, which was within 3 months, but we thought that was still subject to manipulation by an incumbent government. And as part of our broad democratic reform agenda, we committed to a specific date. We passed that into law. That's when the next election will be. Period, full stop. I have given zero consideration to a, quote, snap election. I think it would be dumb. It would break a promise, but it would also, you know, we're cooking with gas here in terms of Alberta's economic recovery. And I want to keep our eye on the ball. We've delivered on about 88% of the commitments we gave Albertans in the last election. I want to get that close to 100%. So I'll be able to look Albertans in the eyes in May of 2023 and say that we did what we said we would do.
Thank you. We have time for one more question. Operator, can you please put through our final caller?
The final question is from Chris Barco, Calgary Herald. Please go ahead.
Hi, this is a question for the Premier. Premier, just regarding your trip down to Washington next week and your appearance before the Senate Committee on Natural Resources and Energy, will you propose or do you have any specific recommendations for U.S. senators on what you would like to see, what you want to see from the United States to increase the energy relationship between the two countries, whether it's regarding Line 5, a successor to the Houston XL project, or even regarding the outstanding NAFTA claim that Alberta has on KXL's cancellation?
So I'll be raising all of the above. At the very least, we would like, and I'll be raising this, we want to see the American administration get off the fence and support U.S. energy security and their own consumers by supporting the legal efforts of Canada and Alberta to defend the Line 5 and the bilateral pipeline treaty against Governor Whitmer's illegal efforts to shut down that pipeline. That would impede the flow of 640,000 barrels a day of reliably produced Canadian energy to her state and the upper Midwest. It would make a energy inflation crisis in the U.S. even worse. So I will be encouraging congressional leaders to in turn encourage the administration to actually speak up for American consumers and our bilateral relationship on that issue. And I will be inviting creative discussions about how we can get another major pipeline built between the two countries. We know that in the current pipeline system, there's a couple 100,000 barrels of current flex. We also know that through optimization, the industry, the midstream industry, could be able to add probably 200,000 to 400,000 additional barrels. And we also know that the Trans Mountain expansion, when complete, will likely be selling over 500,000 barrels down the West Coast to refineries in Washington and California. So I'll be sharing with them those numbers so they understand that we can increase net Canadian shipments to the U.S. by several 100,000 barrels a day, but we could do even more. And what I'll be saying is that, you know, if we got the policy right and if the political will was there, we could completely displace OPEC imports from the United States. So I want to give them a scale of ambition about what's possible if the political will were there. And yeah, I suppose I may also mention the fact that we do have this this claim for damages against the administration under NAFTA.
Go ahead with your follow-up, Chris.
You mentioned that you're going to share the progress that the oil sands is making and the plan for net zero by 2050. Is your government going to release its own updated climate strategy this year, and will it include a target for net zero by 2050 within that?
Well, we have already, in our throne speech of 2020, we articulated our commitment to work with the oil sands producers to help them achieve their net zero 2050 goal. So we've already stated that as a matter of formal policy, and we already have a credible climate policy that involves our TIER program, our significant investments in CCUS and other technologies. And Minister Nixon will have more to say about all of this in due course. But Alberta is a strong supporter of efforts to substantially reduce carbon emissions, realizing that that's not going to happen overnight. I note that since our government brought in an energy-only market and removed subsidies for renewable power production, we have seen Alberta become the single largest place of investment for new renewable energy. So Alberta is leading on many fronts, increasingly on green tech. And here's the great news. Most of that's happening through just the initiative of the private sector. We're there to create the best conditions for it.
Thanks, everyone. That concludes our press conference.
Thank you, everybody. Thank you, Dr. Viner. And by the way, I don't know if I'm still on air. I meant to start by saying that was one last point. Alberta is looking forward to welcoming His Holiness Pope Francis to Alberta in July of this year. He'll be visiting the Edmonton area and on what he calls his pilgrimage of reconciliation and healing. We received a formal notice yesterday from the Canadian Conference of Catholic Bishops, but we've been working with them for the past several weeks on ensuring that will be a successful visit, and certainly very important to Indigenous people across Alberta. We're very much looking forward to that. And I just wanted to also say thank you to Dr. D'Souza, who I understand is wrapping up his last day after many years of service. And thank you to you, sir, and all of the medical staff that do such great work here at the Rocky View.